Good evening, viewers. On behalf of Jaquar Group and IDAC, I am Mohit Hajela, your host for the webinar today, titled Sensor and Sensibility, Design Solutions for Healthcare Facilities. And it's my esteemed privilege to welcome all of you. Today's webinar is going to be a session of an hour, wherein we are going to have two rounds with each panelist, and thereafter we'll have one fireside round. Healthcare industry comprising of hospitals, medical devices, clinical trials, outsourcing, telemedicine, medical tourism, health insurance, and medical equipment is growing at a tremendous pace owing to its strengthening coverage, services, and increased expenditure by public as well as private players. The growing incidence of lifestyle diseases, rising demand for affordable healthcare delivery systems due to the increasing healthcare costs, technological advancements, the emergence of telemedicine, rapid health insurance penetration, and government initiatives like e-health, together with tax benefits and incentives, are driving healthcare market in India. Needless to say, as per latest research projections, healthcare industry in India is projected to reach US $372 billion by 2022, and the projected spend over medical infrastructure is expected to reach close to US $200 billion by 2024. The hospital industry in India, accounting for 80% of the total healthcare market, is witnessing a huge investor demand both from global as well as domestic investors, and is expected to reach US $132 billion by 2023 from 62 billion in 2017. The growth is phenomenal. It's growing at a CAGR of approximately 16 to 17%. While we talk of statistics, COVID-19 has brought changes in our lifestyle and most importantly in our approach to life. The growing paranoia around the world pertaining to touch, acquired infection, airborne infection, public safety in public areas, rules and norms woven around social and physical distancing has all taken alarming proportions. Touch-free solutions, touch-free access controls, and touch-free engagements are gaining traction at various levels of human interface, be it commercial buildings and spaces, lifestyle, entertainment, hospitals, hotels, public utility areas, air, land, or sea transport. On this note, I begin the session today, and joining me is a very illustrious panel of experts coming as Project Director, Medical Architecture Experts and Technical Committee Member with Ministry of Health and Family Welfare, Government of India, prolific architects and healthcare specialists, senior MEP consultant, and an institutional business head from corporate world. To briefly share their experience, it's absolutely a pleasure and honor to introduce Mr. Sanjay Batra, a graduate from IIT Delhi in 1969 in mechanical engineer, with 14 years in Goodyear, India as an engineering manager, followed by 16 years with Oberoi Hotel and the last 15 years with Medanta Hospital as project director, responsible for the construction of Medanta Gurgaon, Lucknow, Patna, and with major renovation in Ranchi and Indore. He is also board of member of India Green Building Council, ASHRAE, ISHRAE, and FSAI. His major achievement is in sustainability, reducing energy consumption in hospitals. Our next panelist is Dr. R. Chandrashekhar, again a very illustrious expert, chairman IGBC Green Healthcare Rating, has a doctoral degree from BITS Pilani in the field of medical architecture. He is the first PhD holder in the field in India. He is also the recipient of numerous awards such as the Genius Millennium Award 2002 and First Humanitarian Award for Outstanding Contribution to the People of India for his work in improving the state-of-the-art architecture for health in India, awarded by none other than Center for Health System and Design, Texas A&M University, US. He has further contributed, he has co-authored a book titled Modern Trends in Planning and Design Hospitals, Principles and Practice. He is an esteemed member of Technical Committee of Ministry of Health and Family Welfare, Government of India, for setting up 6 AIMS like institution and upgradation of 26 existing medical colleges and 39 medical colleges in phase 2 at different states under Pradhan Mantri Swasthya Suraksha Yojana. It's absolutely a pleasure and honor to have you, sir. Following him is a very senior designer from India, having tremendous work. His body of work is immense. It's a pleasure and honor to welcome architect Ravindra Kumar, who has been a visiting faculty at various departments of architecture, has spent years at UCLA, Cornell, Keene State, Marlborough Russ Rapid Urban Sustainability Training Initiative, Berlin School of Architecture, IACCA, Barcelona, Toronto University, besides having a long stint with Bangalore University, RVC, Anna University, Chennai. Currently, he is the reader and chair for long distance studies program at Educational Praxis, Marlborough University, US. He has keen interest in primary education and secondary education and is the president of TBS Foundation, a school where 400 rural children are benefiting. Ravi has been nominated as the brand ambassador for sustainability initiatives towards green architecture, namely Earth Matters, IAB India, Activism Architecture, Design Quest India, and Indian Institute of Designers. Following him, what an honor, Ravi. A pleasure welcoming you. And following him is Mr. R. Balakrishnan, a very senior person again from Larsen and Toubro, an electrical engineer graduate from Delhi University. He comes with a design experience of 20 years in the field of commercial buildings and airports. He has carried out design in the field of electrical, HVAC, public fire public health, ELV systems, IoT for 125 projects. These includes 5 metro airports, average 35 hospitals, including Apollo and AIMS, stadiums, hotels, malls, statues, factories, residential IT parks, exhibition centers, and metro stations, among others. Indeed, a pleasure having you on board, sir.
Thank you.
Then joining us is architect Ajay Gupta. Ajay, again an architect, a designer, serves as director to healthcare and commercial projects at KGD, a Catra design partner. He is an alumnus of Illinois Institute of Technology, US. He holds an experience of over 19 years handling large scale of work in India and overseas. His expertise lies in strategy and feasibility planning, creating efficient and productive designs and budget coordination for hospitals. Before KGD, Ajay has worked with international architectural firms like Pinterest, RTKL, and HDR. He is a member of American Institute of Architects and Council of Architecture. What a pleasure having you on board, Ajay. And finally, we have Mr. Preetam V. Sarma, who is the head for government and institutional business for Jaquar Group. And I'm sure Preetam brings a lot of corporate expertise on board as we begin the session today. Again, a very hearty welcome to all the viewers today who have joined us.